My name is Ted Trevarro, and I'm the Interim Director of Operations here at LCH. LCH has been doing good work in our community for almost 50 years. We're proud to have the trust of our community and to provide critical care for 8,000 people each year. That's 8% of the population of southern Chester County, an amazing number. Most of you are familiar with the work we do day in and day out, providing primary care for so many people. We also provide social services to help people navigate the bureaucracy and access health insurance and other much needed services, educating adults to help them get better jobs and to support their families. But what you may not know is that we here at LCH think of ourselves as a learning organization. We don't ever want to be frozen in time, unable to adapt to changing circumstances. We have a responsibility to our patients to continually improve our quality of care and our ease of access. Our goal is not only to serve our community, but to delight them with our care.
Hi, my name is Barbara Mansell, and I'm the Director of Quality Care and Population Health and current interim co-CEO at La Comunidad España. One example of this is that we participated in a study with Johnson & Johnson last year to see if we could test a new approach to improving outcomes for our diabetic patients. Diabetes is the foremost health challenge faced by our patients, so we're actively working toward adapting our care to helping control the chronic condition. Johnson & Johnson provided us with home testing kits and test strips for our patients, and we launched a program of text messaging to the phones of our diabetic patients. Our providers, via text, reminded patients to take their blood glucose test and text us the results. And then we provided feedback like, "Great job" for a healthy number, or suggestions about how to improve the outcomes next time if the number isn't great. The approach was effective, and we plan to continue it going forward.
My name is Thomas. I'm a patient of LCH. I really enjoy going there. It's very helpful for me. I guess because of my background as being a volunteer fireman and EMS. They ask specific questions as to how they can better provide for their patients. I guess it's more trying to get the patient to be involved as well, to get questions or answers from them. But you can't give up. You just gotta keep trying. That's all you can do.
Hi, my name is Margarita Garay Zarco, and I am the Director of Human Resources and Interim Co-CEO at La Comunidad Hispana. Another example of LCH supporting our community is our new Escalera program. LCH has been aware for some time that the children of our patients are often at an educational disadvantage. Many of the adults we serve are challenged by lower educational levels and are therefore not very well equipped to assist their kids in planning for higher education or career paths, even though, like everyone else, they want the best for their children and want them to succeed. Last year, we had the opportunity to launch an evidence-based program called Escalera, which was developed at the University of Ohio, specifically for Latino teenagers. It is an intensive program for high school students during their junior and senior years. The program is designed to assist them in strengthening their academics, learning about different career paths, and navigating the complicated world of scholarships, internships, college applications, tours, and so forth. Even though this was our first foray into youth education, and we had much to learn, the program has been a great success so far. 14 students have participated in the initial program. 2 of them have already graduated from the program, and we were able to get full funding to start a second group with new juniors at Avon Grove High School. These sessions are being done virtually, of course, and we have been able to support our students with the technology and the know-how they need to be successful.
Hi, my name is Nancy Castaño, and I am a senior at Avon Grove High School. I have been part of the Escalera program since I was a junior, and I have really enjoyed the experience. Some things that I really like about the Escalera program is that it helps me get information on what could benefit my future, as well as get resources that could help me when I go to college. It's also a great way to interact with others, while learning about new opportunities that we can receive. I am so happy that Escalera program is part of my high school, and I can't wait to continue learning about new things. Thank you, LCH.
We've changed in other ways in the past year to meet the needs of our patient population, opening a new pediatric center in March, and adding a psychiatric nurse practitioner to our team to provide more comprehensive help to our patients struggling with mental health matters.
Of course, the COVID-19 pandemic threw a wrench into the machinery, so it's a good thing we are an organization accustomed to change and adaptation. I remain impressed by how quickly LCH responded to the crisis.
I can't explain it in enough words. It's just kind of been a roller coaster ride for me as a hygienist. Routine care was shut down for a little bit, and getting it back up and running, that was challenging with the extra PPE, making patients feel safe. We've gotten, extra stuff like air filters. We're working on a negative pressure room for patients to feel safe, and so that we can, provide the same care we were for the community.
Yeah, so we want our patients to feel comfortable coming into the dentist, getting their regular dental cleaning, the regular fillings. So like Leslie said, we do have these nice filters that filter out the air. We are taking extra steps on keeping our patients safe while they are in the care.
How has COVID-19 affected my ability to care for patients? It's been very frustrating. On the positive side, we've had a lot of resources to help our patients. So between telemedicine, in-person visits, and the tent now turned trailer, we've been able to offer comprehensive services for our patients still. At the same time, COVID-19 has offered a lot of fear in our community, and a lot of people have gotten sick. So the need has become a lot greater, and the availability in some ways has become less.
One that is, I think, why I say it's hard sometimes, like I have this member who needed to do follow-ups with an eye doctor, and LCH right now is doing what is called Uber Health, the transportation, but they don't have drivers right now, and the free transportation for the member didn't have the time to take it, didn't have the spot actually. So it was like so hard for the member to find someone. So we ended up like telling our supervisor and see like if we can accommodate and maybe take this member to the appointment because it was so urgent. And the supervisor said yes, and then we just took him, and it feels so gratifying to take him and knowing that he's gonna continue to have his care. But I think a lot of people are facing this, like they don't have transportation, they don't have someone who can take them, and the pandemic doesn't give them enough of options.
As we're all experiencing this, it's a added stressor for our, especially for the population that we're working with, as well as all of us working with this added stress that we can't really control, and that can be difficult to kind of manage. But I feel like I've really noticed, the resiliency of those that I've worked with. I've been mostly working with women and in the women's health and teenagers and in pediatrics, and kind of noticing how they're adapting and finding ways to cope and also stay connected and not feel so isolated. But I've definitely noticed an increase in people just feeling really stressed, and some increase in anxiety and some depression as well.
So being a nurse practitioner is an extremely rewarding position, but especially during the pandemic right now, it's especially challenging. I think that one of the things we're seeing a lot with our patients is that a lot of their chronic health conditions have not kind of been taken care of at the moment, and a lot of focus has been on COVID-19, which is extremely important, but now we're getting towards the point where we do need to make sure that we're checking their hypertension and their diabetes and following up with people who haven't really been taking care of their health for some months, maybe haven't been able to afford their medications because they've been unemployed or have felt comfortable going to get their medications at the pharmacy, or even felt comfortable coming in person, and for a long time we were telehealth as well.
Seeing only urgent patients at all of our sites. By the end of April, we had the telemedicine up and running and an option for our patients, or as an option for our patients, because we know that so many of them have routine physical and mental health needs that still require regular attention. By May, we had put up a temporary COVID-19 testing unit outdoors at our Kennett site, which is now a temperature-controlled trailer, and we are still using that trailer to keep patients with COVID-19 symptoms separate from all our routine patients. By June, we had pulled together a mobile medical unit to go out to mushroom farms and test their employees for COVID-19. We worked with the Chester County Health Department to conduct contact tracing. We've seen over 1,000 patients for COVID-19 testing and evaluation.
So my name is Sonia Beltran. I work with First Generation Farms and Mazda Mushroom. We are mushroom growers here in Chester County, and we have been in business for close to 26 years now, a little over 25 years. I saw this email that American Mushroom Institute posted about testing, and it was like super early on. It was like April or something. I can't remember. Very early. So I just remember it being slightly chilly outside. And I thought, my only hesitation was like, is this gonna work? You know, are people gonna wanna do it? And I think because it was more just like, do I have to pay for it to do it? Or is it just gonna be like, or am I forced to do it? So we made it, I talked to Amanda from LCH, and I was just like, hey, is there any way we can set this up? It was so flexible because we have a farm out in Nottingham. So we did one day out in Nottingham, and then we did another one here in Tuscarawas, which is closer to the Kennett Square location. So it was a lot easier to do that one. But in total, I think we had like 60 employees who did it voluntarily, and it was great. I think I had most feedback of just like feeling that they were being taken care of, just like I cared, and just like it wasn't more like, I didn't look at it as a business thing. I looked at it more as like a humane thing. I was like, these are people. I think that they would want to know if they are or not infected, and if they are, what precautions do they need to take just in their homes, you know, by on their own, and then we'll figure out what we should do with work when it comes to work, you know. But it was actually really easy. I just think the test was just the most uncomfortable part that of the whole thing. I know that LCH offers wellness. That was one thing that I was mentioning about to some of the employees of offering wellness checks and people who would be interested, because I think more times than we know, people don't get wellness checks, you know, whether it's insurance issues or whether it's just out-of-pocket costs just to do a wellness check once a year, or just out of just not wanting to, you know, you just kind of are like, I feel fine, you know. But I think it's just one of those things where you feel fine now, but then you realize you have high blood pressure and it leads to this. And then if you're your sole provider to your family, how is that supposed to happen if you're end up not being able to take care of yourself? So I think that's such a great option to be able to then offer. I know when probably things get a little bit easier with trying to book things and trying to coordinate with people, since we're still kind of on restrictions wise during COVID, but it's going to be so beneficial to so many. So I think after all my experiences, everything has been absolutely easy. And I'm just extremely grateful to be able to work with La Comunidad Hispana, LCH, and I can't wait to work with you guys in the future.
We continue to adapt as the times change, because we always have in our minds the heart of our mission, to change lives by serving our community as the leading provider of integrated health and community services. LCH is proud to do this, and we are extremely grateful for your support, without which our work would not be possible. Thank you so much for your friendship and your support.